Hello, I'm Blayne Miley, Director of Policy and Advocacy with the Indiana State Nurses Association, here to talk to you about public policy, why, how, and what's going on. The Indiana State Nurses Association is the professional organization for registered nurses in Indiana, and there are similar organizations in every state in the country, all that are affiliate organizations with the American Nurses Association. In Indiana, ISNA is the reason why registered nurses have licensure, have prescriptive authority for advanced practice nurses, and have a code of ethics that's continually updated through work with the American Nurses Association. ISNA exists as an advocacy organization along with other services to help improve Indiana laws for nurses and also to make sure they don't get worse for nurses in Indiana. So why should you be involved with public policy? You have patients, classes, possibly even a life outside of nursing. Public policy is another thing to add to the pile, so why does it merit your attention? Well, the Nursing Code of Ethics is a living document, sort of a constitution of what it means to be part of the nursing profession. It's continually revised by the American Nurses Association and is the embodiment of what it means to be a nurse. It has 9 provisions, and 4 of them speak directly to being involved in public policy as a responsibility for being part of the nursing profession. Another reason to be involved is patient care. Your patients receive a lot of benefit from your care even after they leave your immediate presence, discharged from the hospital or whatever facility you happen to be working in. You give them advice on wellness, nutrition, diet, medication that are going to benefit them after they leave. Another way that you can care for and improve things for your patients when they're not in your immediate care is by being an advocate for them and helping to change Indiana laws for the better for Indiana patients. And that's another piece of what ISNA's advocacy efforts entail. And finally, you can shape your world. The bar to being involved in public policy, especially at the state level, is surprisingly low. If a legislator's office gets 10 phone calls about a bill, that's a lot. That is out of the norm for what they normally receive. Quite frankly, because not that many people are paying attention. And so if you take the step of actually getting involved in public policy, your voice can be heard and you can make a difference. So how do you get involved with public policy? Well, first of all, you need to stay informed. You need to know what the issues are, what the current bills under consideration are, so that you can know when to weigh in and share your views to try and help shape how those laws are created. One of the best ways to stay informed is by joining your professional organization. Now, there are a lot of professional organizations out there. Each state has its own State Nurses Association that's part of the American Nurses Association, and then there are subspecialty groups that are about a subset of nursing. A lot of those focus on education and don't necessarily get involved with a lot of the specific advocacy efforts that the state nurses associations do, like ISNA. Now, ISNA's offerings on the public policy realm include having a public policy platform. It's shaped by our members, and it sets forth issue statements on the position of the Indiana State Nurses Association. So when a legislator wants to know, well, what do Indiana nurses think about this issue? We are who they turn to, and the public policy platform informs us for how to answer those questions. For example, the public policy platform of the Indiana State Nurses Association states that ISNA supports smoking ban legislation in Indiana. That's just an example of one of the many provisions contained in the public policy platform that gets continually updated every year and is decided by our members what it contains. We also have a grassroots advocacy network where members can opt in for specialized alerts to public policy matters. So if there's an issue you really care about, then this is an opt-in mechanism for you to stay involved and receive updates on that issue anytime there's a bill pending or a hearing coming up that affects an issue you care about. It also functions, in addition to hearing what issues you want to know about, The issues that ISNA takes a specific stance on are distributed through the Grassroots Advocacy Network. We also have an e-newsletter that goes out every week and sets forth, here's what's going on in public policy that affects nurses. During the legislative session, which is in Indiana, January to March or January to April, depending on the year, it is a weekly summary of what the General Assembly is considering that's going to affect Indiana nurses. It's put in plain language terms that sets forth what the proposed bill does, what stage it's at in the process, and some background data on why the bill is being proposed or pushed. This helps you stay on top of what's going on so you can know when matters that are important to you are being decided by your legislature. ISNA also has a political action committee. Whether you like it or not, part of being involved in public policy in the United States is making contributions to candidates monetarily, especially during campaign season. ISNA has a political action committee comprised of our members that meet and do fundraising throughout the year, and then during election season make donations to candidates that we believe are important from Indiana nursing perspective. It's a bipartisan donation policy, so it's not about whether a candidate is a Republican or a Democrat. It's about what's in the best interest of Indiana nurses. And the final and most important way to be involved in public policy is to contact your legislators. All of those first 2 points sort of build up to the final point of contacting your legislators, because the legislators are the ones making the decisions, casting the votes about whether to pass a bill or whether to defeat a bill. And by sharing your viewpoints, you can help influence what their votes are going to be. Now, let me give some background on the legislative process. Just a quick overview summary from your 6th grade government class to put in context when it's important to reach out to your legislators when you want to be involved in public policy. Bills are introduced by legislators. ISNA cannot introduce a bill. You cannot introduce a bill. It has to come from a legislator. In every state in the union except for Nebraska, each legislature has 2 bodies, a Senate side and a House side. So if a bill is introduced by a senator, it goes to the Senate. If it's introduced by the House, it goes to the House. Once a bill is introduced, it gets assigned to a topical committee. For example, in healthcare in Indiana, if it's on the Senate side, that'll be the Senate Health and Provider Services Committee. On the House side, it'll be the House Public Health Committee. Once a bill is assigned to a committee, it is then up to the committee chairperson whether that bill gets a hearing and whether it gets a vote in committee. To advance, the bill has to receive a hearing and has to get a vote where a majority of the committee members vote in favor of the bill. These hearings are open to the public and are another opportunity to provide input. Once a bill passes out of committee, it then goes before the full chamber in its chamber of origin. It again has to receive a majority vote to move on. If it does so, it goes across the hall to the other chamber. So if it started in the Senate, it goes to the House, and it repeats the process. It gets assigned to a topical committee again has to pass out of that committee to go before the full chamber. If it passes the second chamber, the language eventually for the bill to move on has to exactly match. So the version passed by the Senate has to exactly match the version passed by the House. If there is a difference, even in a comma, for the 2 different versions, then those have to be reconciled before the bill can move on. The bills can be reconciled through the conference committee process, where legislators from each chamber form a committee to hammer out a compromise that then gets voted on again by the full chambers. Now, any time throughout this process, the bill can be amended, and amendments can be small, adding little provisions, or they can be large, incorporating or tacking on entire other bills. Generally, the amendments have to be germane to the original bill in the sense that have to be somewhat related, but that's a very loose restriction. And that's why some bills that get defeated get resurrected as amendments to other bills. If a bill is able to pass out of the legislature where both chambers have passed the exact same version, it goes to the governor. The governor can then sign the bill into law or veto it. if the governor vetoes the bill, it comes back to the legislature, and the legislature can have a veto override vote. Now, this varies from state to state as far as what's required, but in Indiana, the vote to override a veto is a majority vote, which again is the same it takes to get past the legislature in the first place. However, just because it's a majority vote doesn't mean every bill that gets vetoed automatically gets overridden, because the governor has the opportunity to twist arms and influence how the legislature is going to act. So let's talk about how you go about communicating with the legislator. You can do that in a variety of means. Could be email, could be a voicemail, text, going to a town hall meeting. There are a variety of different mediums, but especially when you're introducing yourself or communicating with the legislator for the first time, they should all follow the same basic blueprint. You want to start by thanking the legislator for their giving attention to your communication. You want to introduce yourself and explain why they should listen to you. You don't necessarily want to go through your entire CV, but you want to give some background, such as name, title, experience, where you work, that's going to put in context why the legislator should be listening to you. You especially want to emphasize that you are a constituent of the legislator, if that's true, or if you work in the legislator's district, because that's going to resonate and draw the legislator's attention. If, for example, you are contacting a legislator about a staffing issue or a proposed bill on nurse staffing, you want to share with the legislator briefly and concisely what your experience is that makes you an expert on how best to regulate nurse staffing. So you then should explain what your position is. If it is about a specific bill, which oftentimes it will be, you need to give the bill number, whether that's a Senate bill or a House bill, what the number is, and then explain what your position is, whether you're in favor, whether you're against, or whether you are in favor if the bill's amended. You want to concisely and clearly state what your position is and then provide support for it. Oftentimes that support should include data to back up your position and explain why your argument should carry the day. You can provide anecdotal evidence also to explain how this proposed bill would affect the real world, because legislators are constantly dealing with bills and speaking in legal terms and statutes, but translating that to how this is going to impact the real world, especially when most legislators are not healthcare professionals, can be an obstacle. And so if you can educate them about how this affects the real world, for example, here's how staffing works now. If Senate Bill 18 passes, here's how staffing would be improved, or here's how the bill would negatively impact staffing. That framework is going to aid the legislator in making their decision and also be in a format that's going to be more receptive to them. You need to be concise and organized. Legislators don't have a lot of time, especially during session, because they will be in hearings all day. They might get back and have 1 hour to check all emails and voicemails and respond. So they may have 20 voicemails and emails and have the time to respond to 5. So you want to be one of those 5, and having a concise, well-organized communication is going to help that. And finally, you want to offer to answer questions. The goal of communicating with the legislator, beyond just the short term about a specific issue, is to develop a rapport with the legislator so that they look to you for expert guidance when nursing issues arise. Legislators are not all healthcare experts. But what affects how they vote? What is behind the scenes in affecting whether they're going to vote yes or no on a bill? Where their personal experience plays a big part of that. And while you can't change their personal experience, being aware of what their personal experience is by engaging in a dialogue about an issue can help inform you about where the legislator is coming from, and also inform you about how best to approach convincing the legislator that your position is the right one. Legislators, when they sit down to vote, they want to do what's best for their district. They want to do what's best for their constituents. But oftentimes they don't know that unless you tell them. So it's very important to educate legislators about how bills are going to affect their constituents. While Indiana has 150 legislators, only 2 of them have ever had a nursing license. Others are bankers and real estate agents and attorneys. And that's why a big part of advocacy is educating them about how healthcare works, especially from the nurse's perspective, so that they can make an informed decision when casting their votes. In addition to trying to vote for what is best for their specific constituents, how this bill is going to affect the hospital in their district, how this bill is going to affect the nurses in their district, legislators care about data. They want to know, on a statewide level, numbers and dollars. How does this bill affect the state from a numbers perspective and a dollars perspective? And also, comparatively, what do other states do? Indiana, and I'm sure Indiana's not alone for those of you outside of Indiana, views the other states as a sort of sim lab where the other states can try out a new policy, and Indiana will take a wait-and-see approach to see how it works there. And if a policy gets adopted by another state and it goes well, that's a reason for Indiana to consider adopting it. If it goes poorly and the law ends up getting repealed, well, that's a reason for Indiana to be cautioned against adopting that policy. And so a lot of comparative data will involve things like, well, 17 other states have adopted a similar law, or 42 other states have adopted a similar law. And as that number grows, it becomes more persuasive for legislators. Another important factor in getting a legislator's attention is to speak in their terms. And there are certain healthcare policy buzzwords that grab a legislator's attention. It sets off a little alarm that I need to pay attention to this. And I'm sure these are universal across all states, but in Indiana, one of the big ones is the brain drain. Students being educated in Indiana and then leaving to start their profession in other states. It is a concern among legislators. They view it as a problem, and if they feel they can do something to improve that, that's going to be something they're going to pay attention to. So anytime there's a scope of practice bill in the healthcare setting, one of the recurring themes among advocates is this will help combat brain drain, where you have professionals in Indiana leaving the state to go to other states because they have a more favorable scope of practice. So brain drain is an important term for legislators. The other 2 are about patients, patient access to care and patient safety. If you can couch what you're asking for, what you're advocating for, in terms of this is going to improve patient access to care and this is going to improve patient safety, that's going to get a legislator's attention much more than, hey, I think I should be able to have this additional scope of practice because I want it and I'm trained for it and I'm qualified for it. That's not going to get a legislator's attention nearly as much as putting it in terms of patients. And the reason for that is among their constituents, legislators have a lot of nurses, they've got a lot of doctors, but more than any other touch point in healthcare, they have patients because every one of their constituents is a potential patient. And so if they can do something that's going to improve patient access to care and improve patient safety, that's something that's going to resonate with them. And is again why any type of healthcare legislation, effective advocates are going to couch it in terms of how does this improve patient safety, how does this improve patient access to care? Going back to our staffing example, if you had a staffing bill that you believed was going to improve patient safety, that's the point to emphasize and lead with in communicating with the legislator. If you have a scope of practice issue that is going to improve patient access to care in medically underserved areas, that's the point to lead with. We talked about the committee hearing process, and specifically, that's an opportunity for advocacy because they're public hearings that anyone can show up and offer testimony to the committee on. Now, one caution about committee testimony, sometimes it can be too late. The legislative session, each bill is sort of like baking a cake, where once the legislative session starts, the cake's in the oven. Now, there are minor changes you can make to the frosting or other sort of ancillary parts, but the ingredients are locked in. So once a bill is set for a hearing, a lot of times it can be too late to make major changes. which is why it's important to be involved in public policy year-round and to stay informed year-round. Additionally, when a legislative committee has a hearing on a bill, often they will vote on that bill at the end of that hearing. So if you have a position that you want to advocate for on a bill, if you wait until the committee hearing to share that, it might be too late because the legislators may have already made up their minds. And even if you're offering compelling points, if they already have a feeling of how they're going to vote going into the hearing, then by human nature and inertia alone, you're already working uphill. You can also provide written materials to supplement your committee testimony. And when you do that, again, it can be better to get that to the committee before the actual hearing so that they have the time to review it just in case they decide to vote on a bill at the end of the hearing. So you want to be cognizant of getting the materials and your information and your advocacy to legislators in a timely manner that's going to better affect them. And again, staying involved with your professional organization is a great way to stay involved and informed about when the opportunities for advocacy are. There are, for example, in the last session of the Indiana General Assembly, there were 1,200 bills introduced. Now, it's asking way too much of you to read all 1,200 of those to look for which ones matter to nursing, which is why using your state nurses association as a resource is a great facilitator for being involved in public policy, because we comb through all 1,200 to identify the ones that are important to nurses. Let me give you some examples of how being involved in public policy can actually work in specific terms. A bill was introduced in the most recent General Assembly session on organ procurement organizations, and it dealt with the terms of contracts that they can enter into with health facilities. But in addition, the legislator who introduced the bill reached out to nurses and wanted to know how organ procurement organizations in Indiana are functioning. What are they doing well and what are they doing poorly? Because although the bill in its introduced version dealt only with the contract terms, it was an opportunity because the legislature's attention was focused on organ procurement organizations to address other issues that might be present to improve how they operate. So the legislator reached out to the Indiana State Nurses Association, and we solicited input from our members on how organ procurement organizations are functioning and shared that with the legislator. And although that bill did not make it out of committee this past session, were it to be introduced, it's quite possible that the input of Indiana nurses will be incorporated in new provisions of the bill. A second example from right here in Terre Haute is legislators in this area have town hall meetings. They're referred to as Cracker Barrel meetings, and they're an opportunity for citizens to come speak with their legislators and share their concerns. And during this most recent session, a bill regarding prescribing practices was introduced, and an ISNA member went to one of these meetings, spoke to one of her legislators that she had established a rapport with, and shared that she had a concern with how this bill on prescribing practices was going to impact advanced practice nurses. When that bill was being debated on the floor of the House chamber in the Indiana General Assembly, her legislator got up and basically parroted her exact words. I have a concern with how this bill affects advanced practice nurses. And that concern was addressed. So by her developing a rapport with her legislator and developing a trusting relationship where her legislator knew she was an expert in what she was talking about, her words made it through her legislator directly to the floor of the Indiana General Assembly. And lastly, models of practice. Connecting legislators with real-world examples and educating them is an important part of advocacy. And this past session, a bill on non-nurse midwives worked its way through the Indiana General Assembly. And as it was happening, there was this perception among legislators that midwifery was illegal in Indiana, which of course is not correct. We have certified nurse midwives, some of whom work in hospitals, others have their own practices. And this incorrect perception had developed in the legislature. So an important piece of ISNA's advocacy on that bill was to educate legislators by connecting them with certified nurse midwives who operated their own practices, to show them the model of how midwifery was currently functioning in Indiana so that they could make a more informed decision when considering non-nurse midwives in Indiana. I want to walk you through a couple bills just to show you the life cycle and the changes that a bill can undergo during the legislative process. The Prescriber Oversight bill that I mentioned before was Senate Bill 246, and it's trying to address an issue of pill mills overprescribing pain medication. There was an epidemic, if you will, in the perception of the legislator with these facilities operating as pain management clinics that would just write scripts for whoever walked in the door and were overprescribing. So they wanted to address it. And the problem that they were trying to address was you would have a facility that was not owned by a healthcare professional, and that non-healthcare professional would then hire a prescriber to come in. So if the Attorney General's office recognized that the facility was overprescribing, they could bust the prescriber, take away their license, but then the facility could just hire another prescriber to come in the next day and keep operating business as usual. So they wanted to address that. And the first way that they tried to address that was through setting out a definition of a controlled drug clinic. And because they were only trying to target these pain management clinics that were overprescribing, they wanted to add regulations, but they didn't want those regulations to apply to hospitals or nursing homes or these other facilities. They really wanted to target just the pain management clinics. And in an effort to just identify those facilities as the ones being affected by this legislation, they crafted a definition of a controlled drug clinic. But it became a problem in how you define that. And the initial version was to say that, well, if a majority of the prescriptions fall into this category of pain management prescriptives, then you meet this definition. They then recognized that there were loopholes and that these pill mills could just have a bring a friend policy where someone walks in, gets a pain management prescription, and they bring a friend who gets a non-pain management prescription, and you've just circumvented the law. So that wasn't going to work. And so they had to look for other regulations because they wanted to impose regulations, and initially were going to say that the facility had to be owned by a physician or a healthcare facility, and then the medical licensing board could impose these additional standards. But there were too many loopholes and workarounds for the proposal to be effective. So they decided to expand the category of facilities this would apply to. And the way they initially expanded it was to say that all facilities that prescribe controlled substances had to be owned by physicians or licensed healthcare facilities. And this would have prohibited in Indiana advanced practice registered nurses from owning their own practice that prescribed controlled substances. Would have absolutely made it illegal even though they're operating currently in Indiana. And when the legislator was confronted with, hey, do you realize you're making this illegal for advanced practice nurses to have their own practice, their immediate knee-jerk response was, well, but they have collaborative agreements with physicians, so the physician owned the practice, right? Well, wrong, but the legislators didn't know that. Again, it shows you how education is an important part of advocacy. And fortunately, that was not the past version of the bill. The bill that was enacted into law dealt with and created a controlled substance registration for the facility, so that a facility has to have a CSR tied to the facility unless it is owned by a licensed health facility or a licensed healthcare professional who already has a CSR. So under the final version, if the facility is owned by, for example, a nurse practitioner with his or her own CSR, they would not have to get this additional facility-based CSR, and a bill that might have outlawed the practice of advanced practice nurses was avoided. Another example I want to share is how bills can take on different forms and how they can be resuscitated. There was a health profession fusion that ended up with 4 originally different bills being combined into one. And how this came about was you had two bills in the anesthesia provider sector. One that would have given an expansion of scope of practice to certified registered nurse anesthetists, and a second bill that would have created anesthesia assistants, an extended position like physician assistants for anesthesiologists. Now, these two bills were introduced in the Senate and were working their way through the process, and as they were working their way through, there was tension between those two groups because the CRNAs did not want the anesthesiologist assistant bill to pass, the anesthesiologists didn't want the CRNA bill to pass, and you had this concern among the legislators that a committee might pass a compromise version of both bills, which the idea of we're going to work out this compromise so both sides get a little bit of what they want, but we think we're doing what's right for Indiana, and here are these compromised version of the two bills, but then one of the bills gets killed and one passes, and now what ends up going into law is not the full picture that they had envisioned. And to remedy this, once the bills got over to the House side, the committee put them into one, so that now if the anesthesiologist wanted to attack the CRNA bill, then they would be defeating their own bill that they wanted to pass. So it forced the two sides to either get nothing or get what they wanted, as well as giving the other side what they wanted. A lot of times in the healthcare profession, especially when you're dealing with scope of practice, you have arguments that end up sounding a lot like turf wars. It's just the nature of this advocacy realm, and it's why you often have these compromise situations like this one evolve. So how did dietitians and music therapists end up in this bill as well? Well, the House had passed a bill on dietitians and a bill on music therapists. But when those two bills went over to the Senate side, they did not make it out of committee. So when the House bills, when the House was dealing with the Senate bills on anesthesia, they decided to add to the anesthesia bill this dietitian provision and the music therapist provision, basically telling the Senate, you want the anesthesia part that you passed, we want our parts to pass. Now, if you want your anesthesia bill to pass, you also have to pass the dietitian part and the music therapist part. So put all four professions into one bill as a sort of conglomerate. So here you had not only different advocacy groups, but different chambers trying to get what they wanted and having differences of opinion and engaging in political maneuvering. So it's just somewhat of how the sausage can get made, and also an example of how if a bill dies, it can be resuscitated in the form of an amendment to another bill. Let me give you a brief high-level overview of the Affordable Care Act, because that's what's garnering all the national headlines in the realm of healthcare public policy. The goals of the Affordable Care Act, what it is trying to do, is to expand health coverage, make it easier to obtain coverage, and improve coverage. How specifically it's trying to go about this, for expanding coverage, it sets forth mandates where individuals have to have coverage or pay a tax, and employers at certain levels have to provide health coverage or pay a penalty. So it's creating a carrot-stick dynamic to try to get more people to have coverage through their employers, and for those that don't, incentivize them to obtain health coverage on their own or pay a tax. Now, in making it easier to obtain coverage, they've created marketplaces. And marketplaces are going to vary from state to state. Some will be state-run, some will be federally run. And the marketplaces are ideally going to be in orbits for healthcare. Now, there's a very wide spectrum between orbits, easy selection for figuring out which healthcare options are, and filing your taxes in terms of the level of complication. And right now it's in the middle somewhere. But these marketplaces are a way to make it easier for individuals and employers to obtain coverage. And especially for individuals, there are federal subsidies available at certain income levels. So you've expanded the class of people who are getting coverage. And one of the other ways they are trying to do that is by expanding Medicaid, making Medicaid available to a broader class of people. However, this Medicaid part is optional by the states. So states are not required to increase the pool of people that are eligible for Medicaid, which is why you see a lot of headlines about whether Ohio is going to expand Medicaid or Arizona or Indiana, what these states are going to do, because it's their option. And it wasn't originally their option, but when the Affordable Care Act was challenged and ruled upon by the Supreme Court ruled that the Medicaid expansion was optional, which is why states have the discretion whether to expand it or not. The final goal of the Affordable Care Act is to improve coverage. It sets forth additional requirements on insurers so that their plans have to offer essential health benefits, which is 10 categories of health coverage that have to be included in their plans, and also limits how much of your premiums insurers can spend on non-benefits, how much they can spend on marketing and accounting versus actually paying out benefits. And if they don't meet this threshold, then they have to pay a reimbursement. It also tries to improve Medicare by reducing the prescription drug gap. Right now in Medicare, you pay up to your deductible, and then prescriptions are covered, and then once you hit a certain threshold, prescriptions are not covered until you get to the catastrophic level where prescriptions are again covered. So you have that gap in the middle, and one of the provisions of the Affordable Care Act is to narrow that, to make that smaller so that there is a broader spectrum of coverage. And finally, for healthcare providers, another way that the Affordable Care Act is trying to improve healthcare is by incentivizing healthcare providers to maintain quality and decrease costs by penalizing hospitals for high readmission rates and offering cost sharing for hospitals that reduce their expenses while maintaining quality. Each state has the discretion to approach the implementation of the Affordable Care Act in its own certain way. One of the ways that Indiana is looking at it, just to give you an example, is through the Healthy Indiana Plan. And this has been suggested as Indiana's approach to Medicaid expansion. Now, as we're recording this in August, the Healthy Indiana Plan is currently out for extension, which in the Healthy Indiana Plan currently serves 40,000 Hoosiers. And the Medicaid expansion would be for 400,000 Hoosiers. So as of right now, it's being batted around as a possible alternative to Indiana expanding health coverage, but not using traditional Medicaid, but still using the federal dollars, and instead using the Healthy Indiana Plan. What's the difference? The Healthy Indiana Plan requires participants to make contributions to receive benefits. So they have to pay into a power account that is a sliding scale. Up to 5% of their annual income has to be at least $160 a year. That then gets used up as they receive benefits. And as they make contributions, the state also makes contributions to ensure that an annual amount of $1,100 gets into that account, and the state contributions roll over to the next year only if certain preventative services are using. And the reason why policymakers prefer the Healthy Indiana Plan as opposed to Medicaid is they have this perception that Medicaid in some ways is broken in terms of fraud and waste, and they believe that the Healthy Indiana Plan will lead to more economically sound use of healthcare benefits. They believe that when someone is deciding at 11 o'clock at night whether to go to the emergency room or wait the next day to see their primary healthcare provider, if they have some skin in the game, some of their own money at stake, they might make a more financially sound decision in terms of how much they're going to cost the healthcare system. The Healthy Indiana Plan also has caps on the annual and lifetime benefits one can receive and also on the enrollment, which makes it a more budget-friendly program. So that's an overview of what is going on a very broad level, getting the national headlines in public policy. And in addition to your professional organization, there are other informational resources available to you to stay on top of what's going on. The Centers for Medicare and Medicaid Services, U.S. Department of Health and Human Services, Health Resources and Services Administration are all three federal entities that share information and updates about what's going on. Now, because these are federal entities, what they share may be slightly skewed towards favoring the initiatives of the administration. However, if you're getting your information from other news sources, they might be swayed against the administration. So you always want to be conscious of who you're getting your information from, which is another benefit that your professional association will provide, is trying to give you a balanced viewpoint and a viewpoint from a nursing perspective as opposed to from a Democrat perspective or a Republican perspective. Additionally, I've listed here the website for the Healthy Indiana Plan for you to stay updated with that, and two nonprofits that I wanted to share that on a federal level are very involved with informational education programs in healthcare public policy, and that is the Kaiser Family Foundation and the Robert Wood Johnson Foundation, both of which are excellent resources for you to stay involved with what's going on. And finally, I wanted to share with you how to connect with ISNA. You can connect with us through our website at indiananurses.org. You can like us on Twitter, follow us on Twitter at Indiana Nurses, like us on Facebook. And finally, my contact information, again, my name's Blayne Miley. I'm the Director of Policy and Advocacy for the Indiana State Nurses Association, and I encourage you to get involved with public policy because you truly can shape your world, and legislators want to represent their districts, they want to represent their constituents. They don't know how best to do that until you tell them, and they aren't going to come ask your permission before they change the law. So I encourage you, get involved, stay involved, and help shape your world. Thank you.